Hey, Dr. Ojo-Carons.
Hey Hannah, how are you doing?
I'm okay. How are you? How's things from where you sit?
I'm doing okay. I'm just getting off of a shift at the hospital. I was on call and had a night that was rough physically and also emotionally, mentally too. And so I'm doing okay, but I have a few patients that aren't, and it's just kind of got me in a place where I feel like I want to talk, and also hopefully provide some information for clarity for those who are listening today. I want to talk about COVID and the vaccine and how necessary it is. So, there's been a lot of political talk around the disease, prevention of it, and also treatment of COVID. And I think, it's been time, and many have been in my place in which they've tried to do this. And it's really just to have real talk outside of politics, because we're talking about life and we're talking about death. We're talking about living to the fullest and being happy and healthy, or potentially facing your end or the end of a loved one. And that's real. And so politics needs to be aside from that. We, as a society, require our children to get vaccinated to go to school. You have to get your MMR. You have to get your measles, mumps, and rubella vaccine, even to be enrolled in most schools, especially public school. And so parents do that without batting an eye because it's required. And it's just historically what's been done for years. It's a vaccine that you're getting. And so my question is, what's the concern, or what is the issue with getting another vaccine or doing another intervention that's even more simple than receiving the vaccine for those who can't, young children under the age of 12 at this point in this country, with wearing a mask to prevent them from getting sick or prevent other kids around them from getting sick. So it's we have to talk about it. We as women are very important parts of our families, and so we wear many hats and hold many responsibilities. And so we need to be there. We need to be there healthy for our family, for our kids, our loved ones. So to be healthy, we have to protect ourselves. I have a patient that is not doing well today, and she is pregnant. And she is, from all viewpoints, going to lose this battle with COVID. And she went into her pregnancy healthy, and she was healthy during her pregnancy, no comorbidities. She's young, and she likely will not make it because she did not get vaccinated, in part because she did not get vaccinated. And she did not get vaccinated because she was concerned that the vaccine was unsafe because she was pregnant. It is not unsafe. It's quite the opposite. It is safer to be vaccinated against flu. It is safer to be vaccinated against pertussis. It is safer to be vaccinated against COVID in pregnancy, for your pregnancy, than not to be. There's no evidence that it's unsafe. And so the thought process or excuse that I'm pregnant so I can't has to be laid aside. I feel that if you don't want to get vaccinated, that's a decision, and that's fine. But then we also talk about the other measures for prevention of obtaining the virus and of spreading the virus, which is masks, which is isolating, which is not going out into crowds without a mask, going out into public without being masked, or being around many people at one time, which is staying your distance away from people. These are simple. These don't require you to get the jab. These don't require you to be uncomfortable because of the vaccine, to have symptoms, chill, or whatever concern is because of vaccine. These just require you to take a couple measures to care for your fellow human being. And that's another way to protect yourself. That's very simple. And so I'm in a position now today where I have many patients that come into my office, and I see many women in the hospital, and we talk about being vaccinated. And for the majority of those that I see, a lot of them say no, they don't want the vaccine because of a lot of just misinformation, and it's disheartening. It's disheartening.
Wait, are there any particular pieces of misinformation that you want to dispel, or is it's kind of all across the board, not worth bringing up?
I think there's so many pieces of disinformation out there that we would spend a while dispelling them. But just to be direct, specifically for pregnant women, you have to think about pregnancy as a state of a time in which you are immunocompromised. Even though the first wave of the variants that we had that came out maybe did not affect pregnant women initially, or did not seem to make pregnant women very sick. This is a different variant that we're dealing with. And pregnant women are getting sick. Pregnant women are losing their lives. Pregnant women are losing their babies during an active infection if they go into the hospital and they get sick enough. And so that's a big myth to dispel. Getting the vaccine in pregnancy does not put you at a higher risk in your pregnancy. There are many other things that we actually do in our pregnancies that put us at a higher risk. One is being overweight, right? No one's really talking about, hey, put that eclair down during your pregnancy, because that actually is increasing your risk of gestational diabetes that can actually make your pregnancy more complicated and high risk. So it's really putting things into context and understanding, hey, this vaccine is not one of those measures that would increase your risks or make you have a high risk pregnancy. It actually will help. It will actually help to reduce your risks in pregnancy.
Okay. So I think that one of the big pieces of information that went out in the very beginning was that this was mainly for immunocompromised and older people. Or is it?
It's still the case. It's still the case, but I think it's also the case, what we're understanding is that this is just everyone. The more immunocompromised you are, the higher risk you have of getting any type of infection. But this is also, everyone has a risk of getting this infection. We're seeing younger people in the hospital sicker. We are seeing kids now, because of everyone going back to school, those school districts that went back to school earlier, where a lot of kids have gotten sick. And that was not the same as in early 2020. The virus is mutating. The virus is changing. There are different variants. And so with different variants become different virulencies. They have an effect on different populations. And so at this point, we have a population that has been covered, right? Because there was pushed, immunocompromised, older adults get vaccinated. And that population has gotten vaccinated. And now we have a large population that's like, hey, I'm good. I'm young. I can make it through. I've heard this many times. I feel like if I got COVID, I'd be okay. There is no way to know that. There is literally no way to know that. So why take the gamble? And I am a vaccine proponent. I feel that, yes, everyone should be vaccinated. But I do understand we have freedom of choice, and that is wonderful. So make that freedom of choice to not get the vaccine, but continue to do those measures that need to be done to prevent the spread of this virus. Continue to do those measures that need to be done to prevent you obtaining this virus. And that is masks, that is distancing, that is not going out into large crowds and being unmasked just because you feel good. This virus is spread without you knowing that you're spreading it. Mm-hmm. So we have to get to a level in this country where we are talking about our concern for our fellow citizens, that we're talking about concern for our fellow neighbors. We're talking about concern for just other people around us, as opposed to our own individual desires only. I don't want my kids to always have to be masked. They're young. They missed out on now 2 summers, and it sucks for them. But I also want to make sure that I am keeping in mind that we're keeping other kids around them healthy too. I want to make sure that I'm keeping in mind that other kids that are at the pool or other kids that are at the park, that I myself am helping in the community to keep them healthy by keeping myself masked, by getting my vaccine, by keeping my children masked. I don't think that's a big ask. When you go on the subway, you'll see a sign that says, for the disabled or the pregnant, those that can't stand, please allow them to sit. That's kindness. Why can't we do that with a simple measure as a mask or distancing? You know, that I'm so confused by that, why we have this dichotomy in this country where we do a little bit here that we're concerned, but in an area just because it's politically charged that we're not doing it. And for those people who feel that, hey, it is a burden on them, my main question is why? What is the burden? What is the burden? When you get sick from this disease, what do? You call your doctor, or you go into your doctor's office, or you go to the hospital. Do you not think that's a burden for your doctor, for the doctor's office, for the hospital? Do you not think it's a burden for the receptionist that you go in front of when you first enter the building? Do you not think it's a burden for those people that have to come back and clean the room that you were in and potentially exposing them? Do you not think it's a burden for their children at home? Do you not think so? Where does the burden lie in which we have to all shoulder it together? And when do we start really thinking about that? This is a serious virus. And so just because you don't see people falling out on the street doesn't mean that there are not a lot of people falling out somewhere else. They're falling out in the hospital. They're dying in the hospital, and I'm seeing them. And I'm tired of seeing it. I'm tired of dealing with it. And I'm tired of the whole ordeal. And so there has to be a point where the conversation shifts to more of, let's care for each other. Let us move forward and let us do better.
I have read now 2 books in a row, or I'm in the middle of reading another book that heavily focuses on trees and how interconnected they are to one another. That if they're going to fruit, they all fruit together. Every species of tree in the forest would all fruit together, because it's when they're all bountiful together, it ends up paying off. If they're going to save their energies in reserve, they all save. Point being, in these models from these 2 books, everyone is so interconnected. We're so interconnected with one another. And one of the biggest things I'm hearing from you is people forgetting that connection, because you are not an ICU doctor, and you wouldn't be who I would think of as being a person who's day after day after day getting exposed to COVID patients. And yet you are, and you are having to choose between your oath that you took to provide care for patients, but then also you're coming home to your children who are young and have not yet aged into vaccination status. So you're choosing between oaths to your profession and then the oath that you take by becoming a mother or a caregiver. And so I think it's really important for non-medical people to hear that perspective, because we've been in this now for so long that there's a fatigue and there's a lack of being used to any sort of thing that makes us at all uncomfortable. It's easy, if you're not exposed to it as you are, to kind of forget about that part, or to have adapted in a way where it's not top of mind. So I think it's really important that you shared that today.
You know, at this point, it's almost 2 different worlds I live in the hospital and with the exposure to just COVID and patients that are sick from COVID, seeing them being rampant. And the other world where you go outside and you're in the grocery store and everyone's unmasked. And it's getting harder and harder to reconcile those 2 worlds. It's getting harder and harder to leave one world and enter the other one and not be frustrated and angry and just let down. It's really getting tougher and tougher, you know, to keep a clear mind and also a clear perspective on what's happening. We have to do better. We have to do better. I'm not an intensivist. I'm not in the ICU every day, but I see this every time I enter the hospital. And you know, I'm human. I'm human just like you. I'm human just like anyone watching this. And and it does start to break you. It really does. It starts to make you think where my loyalties should lie, because you start to wonder, where are the loyalties lying for the person that you're caring for? Because just like you said, Hannah, I have kids, I have family, and I have friends that I love. And I've had people get sick. And my first thought is, you know what? I did a C-section on a patient that had COVID the other day. Did I transfer it over? Or I had 5 COVID patients this last shift. Did somehow I bring it home? So yeah, it's tough. It's tough.
It sounds exhausting. And I think that we should also consider what care is like, just care for non-COVID, all the other things that we would regularly have, when our entire healthcare system has been bearing the weight of this pandemic for as long as they have, you know? Thank you for sharing that. I think it's an important reminder.
Yeah, I hope we have a happier talk next time. But I think it's really important to discuss this. And thank you for encouraging me to give my perspective.
Yeah. Thanks for listening, you guys. Appreciate it.